Hello and welcome back. So, we will start our lecture on abnormal labor. Remember, we already covered normal labor, so it is somehow related to that lecture. The basic terminology, of course, it's the same. Now, we will see how to differentiate between normal and abnormal labor. Partogram, we had already mentioned, so it's very important because it detects timely if things are progressing normally and if a labor is turning from normal to abnormal. And then there are three P's when we talk about abnormal progressing labor. You should know about them. So this is just a revision. There are three stages of labor. In the first stage, cervix achieves full dilatation. In the second stage, there is delivery of the fetus. In the third stage, there is delivery of the placenta. So here, actually, we are focusing on the first stage, okay? Spatially, yeah, of course, the latent phase, but spatially the active phase of the first stage of labor. So we are mainly focusing on that one. Okay. So, how do we define abnormal labor? Do you remember we defined normal labor and there was a WHO definition like it should be a singleton pregnancy, it should not be twins, it should be at term, like 37 completed weeks. The baby's presentation should be cephalic or vertex and it should start on its own. Okay. And then, if you remember, we had said when a woman is in labor, routinely in general, vaginal examination is performed every 4 hours. And what do we expect? At least 2 centimeters of dilatation in 4 hours. Of course, we had said that sometimes we need to do it more frequently, but in a woman, regardless of whether it's multigravida or primigravida, the routine is repeating vaginal examination every 4 hourly. Now, normal labor refers to the presence of regular uterine contractions. This cause progressive dilatation and effacement of the cervix in fetal descent. So, whenever there are regular uterine contractions, how do we confirm labor? By performing a vaginal examination and we check whether it is causing dilatation of the cervix or not. And that's how we define labor, right? Or detect labor. Now, in abnormal labor, it has a few alternative terms. Abnormal labor is also called labor dystocia or cervical dystocia or failure to progress. Okay, so they are kind of changed. These terms are used interchangeably. So this problem is the most common indication for primary cesarean section, which means if a woman is having C-section for the first time, this is one of the most common indications, okay, accounting for 3 times more cesarean deliveries than male presentation or fetal heart rate abnormalities. So actually, it says it's the most. So before I go discuss the next slide, see what are the common causes a woman has C-sections. Okay, so if you just think, yeah, one of the common ones is CTG abnormalities, right? Or presumed fetal distress. We think that maybe baby's not doing well. So its first is presumed fetal heart abnormalities. Then maybe the cervix is not dilating, right, which is poor progress, right? Then fetal male positions and male presentations. For example, if it's occipitotransverse, right, or deep transverse arrest, for example, or if there is, for example, a breach, right, for example, a footling breach. So fetal male position, male presentation, all of these, and of course, previous C-sections. The more is the higher is the number of C-sections, of course, right? With one or even theoretically two, yes, we can offer, but three is definitely again a C-section. So today we are just going to discuss about this cervical related to cervical dystocia. Now, see, a lot of women still in this age, majority of women in Africa and Asia, they are delivered at home. They have home deliveries. And home deliveries mean they are unsupervised. Okay, like they are delivering on their own. Usually it's a relative who is delivering them, maybe mother-in-law or even an untrained personnel. It's not like someone delivering at home in the UK where there are trained midwives. It's properly planned. It's not like that. So okay, so how do they? It's this. There is a famous African proverb, and this is correct. So Actually, they say, and how do they know that labor is normal or abnormal? They basically say a woman in labor should not see the sunrise twice before the baby is born. What does that mean? For example, if a woman goes into labor, for example, at 8 o'clock in the morning, right? For example, today, okay? So then she will see a sunset tonight, to this evening, right? And she will see a sunrise tomorrow, okay, if she's in labor. But she should deliver before tomorrow's sunset, because today she already saw a sunset, okay? And similarly, it's the same. So a woman in labor should not see the sun rise and sunset. It applies for the same, it's correct for the same. So sunrise means, for example, if a woman went into labor, started labor, for example, at night, at, for example, 12 o'clock at night, midnight, okay? So she will be in labor when the sun rises, okay? And then see, if she's not delivered, she will see a sunset, okay? And then, but she should deliver before tomorrow's sunrise. So that means she should not see, a woman in labor should not see a sunrise or sunset twice. That's how it is timed, okay? So, okay, so there is an important condition. I have shared the link. There are two links actually. It is called obstetric fistula. You should know about this condition. Obstetric fistula means it's mainly obstetric, but sometimes it can happen iatrogenic because of even gynae procedures if they are not performed, especially hysterectomy, if it is not performed by a very well-trained doctor. But most of the fistula is, how do we define fistula? Fistula is actually abnormal communication between the epithelium of two organs, right? So, for example, if there is an abnormal communication between, say, for example, rectum and urinary bladder, for example, that's a fistula. Or if there is an abnormal communication between urethra and the rectum, that's also a fistula. So what do we mean by obstetric fistula is, if a woman, say for example in Africa or in Asia, being home delivered, there is no trained personnel who can see whether it's going normal or abnormal. If the labor takes very long, even the woman is fully dilated, right? But say if it's a deep transverse arrest, right? The baby's head did not turn, or if the maternal pelvis is small, then what will happen? The baby's head keep compressing on the pelvic structures, right? On the lower part of the uterus or the cervix, and because there is bladder as well, right? So ultimately there is ischemia, because once it is obstructed, when it is an obstructed labor, it may last even for many days. The people just keep waiting, and meanwhile what happens, there is ischemia. So ultimately, they will take her to a nearest hospital, which may be a few days away, right? There, just imagine there may not be any roads. So across mountains or somewhere, they will ultimately reach a hospital. By that time, 90% of the cases, babies are dead. And then the baby is delivered by a C-section, but the damage has been done because there was ischemia. So at that moment, nothing will happen. But a few weeks later, what will happen? There will be sloughing of the tissue, which was ischemic. And then, depending on at what level the ischemia happened, there will be abnormal communication, fistula, say, for example, between the bladder or the vagina, or between the cervix or the bladder, or vagina or urethra, or even rectum and some other structures, or vagina, for example. So there will be abnormal communication. And how will the woman present? It's incontinence. Mostly it's incontinence of urine. Sometimes it can be even incontinence of stool. And then, do you know, instead of helping these women, because they are poor, right? So because it's smell, so there is a lot of smell. When women are incontinent, their families just ask them to leave. They are divorced, they ask them to leave their home. And these poor women, they don't have anywhere to go. So I will talk more about this, but just watch these videos, okay? So there are two separate videos. Watch this, and sometimes it's because of poor surgical technique, even in gynae, right? If it's a hysterectomy, because urethra and urinary bladder, your ureter is very close to the cervix, right? And urinary bladder is also just in front of the uterus, right? So due to poor technique, or it can happen even after gynecological surgeries, but it just ruins the lives of women. If you watch these videos, then you will understand what I'm talking about. Okay, I'll stop here, and then in the next part of the lecture we will discuss about what causes an abnormal labor. Okay, yeah, I'll stop here.